Hello, everyone. My name is Asian Rochester, and this is my teaching project presentation. The topic chosen for my project is medication noncompliance patient education, specifically with those suffering from chronic illnesses and diseases. Chronic illness is the leading cause of death in the United States, accounting for approximately 70%, which is 125,000 deaths per year in this country. 6 out of 10 adults in the country have a chronic illness, with 4 out of 10 having 2 or more comorbidities. In medical surgical nursing and acute stroke care, patients are often seen not adhering to their prescribed medication regimens, which results in poor disease management, recurrent rehospitalizations, and global worsening of diseases. Medication compliance is important for those with chronic illnesses to improve patient outcomes and decrease complications. So, as previously mentioned, this teaching project is geared to those with chronic illnesses and diseases. These patients are typically aged 18 and older. However, the prevalence of multiple chronic conditions is higher among older adults. For race, I found in my literature review that non-Hispanic whites have a higher reported prevalence of chronic conditions than any other racial or ethnic groups. And I also found with gender that just over 100 million people have multiple chronic conditions, and 54 million of them are women. Women between the ages of 18 and 64 have a higher prevalence of multiple chronic conditions than men. So for this teaching project, it's going to be a 60-minute group discussion seminar at a local hospital auditorium or a community center. The educational philosophy chosen for this project is behavioral theory. Behavioral theory is simple and easy to use, and it promotes behavioral change and skill development. Learners are able to take on an active role in their education, practice new skills and knowledge, and they receive feedback. The framework chosen for this project is Braden's self-help model. It proposes a teaching approach that the nurse can use to encourage independence in patients versus them feeling helpless or responding passively to interventions. It also gives recognition to the resiliency of people and provides a means of describing how to enable skills that help individuals meet the situational and cognitive challenges of their illness. So the 2 teaching goals for this project is to first, after 1 month, patients will increase their knowledge of chronic illnesses and medications and be able to list 1 benefit of compliance. The second goal is that patients will be able to understand the importance of compliance of their prescribed medications and maintain 60% adherence to their medications for the next 3 months. The first learning objective is to define medication compliance adherence and its effect on chronic illnesses. Patients will learn how to differentiate between chronic illnesses and diseases and list 1 complication for each. Next, they will discuss 2 reasons for taking prescribed medications and its importance to treating or preventing chronic illnesses. The next learning objective is to discuss 3 barriers of medication adherence. They will define and list 1 way to improve health literacy and lists 2 resources to help reduce medication costs. The next learning objective is to demonstrate 3 techniques for medication compliance. They will demonstrate filling a weekly pill box with 100% accuracy and then explain 2 different methods to create reminders for medication administration. So there are 2 teaching strategies and 1 learning activity for this project. The first being lecture. Lecturing is a highly structured method by which the educator verbally transmits information directly to a group of learners for the purpose of instruction. It presents main ideas in a unique way. It helps describe patterns, and an instructor can include their own personal expertise, both theory and experience, to help the learner understand. It's easy to be supplemented with handouts, PowerPoints, to help enhance learning. The next is demonstration and return demonstration. Demonstration is done by the instructor to show the learner how to perform a certain skill. Return demonstration is carried out by the learner to establish competence with cues from the learner as needed. It helps actively engage the learner, provides an opportunity for overlearning to achieve the goal. And last is group discussion. Group discussion has proved particularly helpful to patients and their families dealing with chronic illness. The learners share information for cognitive growth, learn self-efficacy, improve coping mechanisms, and discover habits to incorporate needed changes for disease management. Evaluation methods. So the 2 that I used was content evaluation and outcome evaluations. Content evaluation is to determine whether learners have acquired the knowledge or skills taught during the learning experience that occurs immediately after completion of teaching, but it counts for all learning activities included in that specific experience. So with that, I use return demonstration and teach back for my tools. And then for outcome evaluation, it determines the effects of teaching efforts. It's a summative that measures the changes that result from teaching and learning through using learning outcomes. So basically, the learner knows what to expect and can apply that information once they attain it. And the tools used for that are question and answer and post tests. So for conclusion, strengths of this project are that nurses have a great responsibility in facilitating change through knowledge and influence behavior change. Patient education, as we know as nurses, is a significant part of our job. Through education, we can empower patients to improve their health status and want to be active in their care. Some areas of improvement, I would say possibly making the seminar, instead of a one-time seminar, maybe a couple of series. Sometimes people need to learn information or have it presented to them multiple times for them to retain it. So I would say that would be the area of improvement. And then recommended education. As previously mentioned, chronic illness and disease in the United States is growing. Health education is an important solution to teaching people how to successfully manage their disease, adhere to their medication therapies to prevent complications. And then here are my references. Thank you so much for listening. I hope you enjoyed and I hope you learned something.